Thank you for joining today's webinar. Today we're going to be reviewing UCR Health and specifically cardiology, so we can learn more about what UCR Health offers in terms of cardiology. Today, Dr. Padmini Varadarajan, I'm going to let you correct that, I apologize. Dr. V, she is our cardiology specialist. Her patient philosophy is to greet her patients with a smile, be on time, and be empathetic. And she considers them as one of her family members. So with that, I'd like to welcome Dr. V. Thank you so much for joining today's webinar. And I will let you kick it off from there.
Okay. Hello, everybody. It's such a great pleasure to be here today. As Stacy said, my name is Padmini Varadarajan. I'm a professor of medicine and an academic cardiologist at UCR School of Medicine, and I practice at UCR Health at the Citrus Tower at the Multispecialty Clinic. I am board certified in internal medicine, echocardiography, adult congenital heart disease, and cardiac computed tomography. Prior to this, I was at Loma Linda, and I'm a clinical scholar and also an avid researcher. I have many publications, peer-reviewed manuscripts, books in cardiology, and book chapters. I am also a director of the Structural Heart Imaging and member of the American College of Cardiology Diversity and Inclusion Committee, and now I am the chairperson for that committee as of last year. Here at Citrus Tower, we treat any patients who might have cardiac issues. Some of the examples are any patients with chest pain, dyspnea on exertion or shortness of breath, anybody who has a murmur, any arrhythmias, abnormal ECG, pre-op evaluation, post-stroke evaluation, anybody with adult congenital heart disease. So any patient who has a history of prior cardiac history or ongoing cardiac history, we see all those patients here. The services we offer here are a complete echocardiograms, treadmill stress echocardiograms. We will be adding pharmacological stress tests, aka i.e. dobutamine stress echoes soon. We'll also offer Zio patch, which is the Holter monitor, which is you can extend to 14 or 28 days. We hook them in the clinic or we can send it to the patients. This is mostly for evaluation of any abnormal rhythms like atrial fibrillation or flutter or ventricular arrhythmias. We also see patients who have congenital aortopathies, i.e. Marfan syndrome, Lewis-Dietz syndrome, familial aortopathies, any of the aortopathies, bicuspid aortic valve with aortopathy, we see those patients here. Infiltrative cardiac diseases like sarcoid or amyloid, hypertrophic cardiomyopathy, which is a familial cardiomyopathy, which entails not only screening the patient, but also their first-degree relatives. These patients have a very high risk of sudden death, so they need excellent cardiac care. We also see patients with valvular heart disease, basically aortic stenosis or regurg, mitral stenosis or regurg, tricuspid valve diseases, and pulmonary valve diseases. I also see patients with high risk OB. These are pregnant patients who might have had cardiac problems, especially with aortopathies or adult congenital heart disease or bicuspid valves, who also need cardiac care to help them have a safe pregnancy and a safe delivery. We also see patients with cardio-oncology. These are patients who have oncological diseases and are on numerous chemotherapeutic agents, especially with the newer tyrosine kinase blockers or checkpoint inhibitors. These have a lot of effect on the myocardium. Patients end up getting myocarditis, heart failure, or myocardial infarction. So these patients need to have echocardiograms prior to starting their chemotherapeutic agents, and they also need periodic monitoring. Cardiorheumatology is another set of patients who have rheumatological diseases like SLE or scleroderma. And these patients can have pulmonary hypertension because of their immune processes. They can also have valvular diseases, especially with the SLE. They can have non-thrombotic bacterial endocarditis, which is the Lingman-Sachs syndrome. So these patients need periodic monitoring with an echocardiogram, and they also need to be evaluated for coronary artery disease. We also can see patients with adult congenital heart disease. These are patients who have had heart disease when they were born, and they need periodic monitoring with echo and a clinic visit. And in July, we will be offering interventional and peripheral arterial and venous disease evaluations in the clinic here with another provider. I have two of my team members here. Diana is the clinic manager.
Hello, welcome. Thank you for joining us today. Just wanted to go over some of the information of our clinic that we offer. We are open Monday through Friday. Some of the services that we offer are primary care, family medicine, internal medicine, pediatrics, cardiology, neurology, and endocrinology. You guys are more than welcome to join our website or give us a call to schedule an appointment or to get more information. Another member that we have here is our Echo Tech, Bobby.
Hi there, I'm Bobby. I'm a registered sonographer and I've been doing echo for 24 years now, and I've had the pleasure of working with Dr. V for about 20 years. And look forward to having you and look forward to seeing your heart and helping you out.
Perfect. Thank you so much. And for those of you who are interested in booking an appointment today, here is information. We can help book an appointment by calling 1-844-827-8000, or you're welcome to complete an online appointment request form. Both ways are effective, just whichever way you prefer. Diana, maybe you can touch on My Chart, but we do offer My Patient Portal to all of our patients.
Yeah, My Chart Patient Portal is pretty much a easy link to your chart. You are able to print your lab results once the provider releases them. Once you register, we will send you a link to your email address, and you're also able to schedule your primary care appointment via My Chart through the portal. We will give you the instructions when you come in, or we can email them to you, and you're able to also view your appointments and review some of your records online. Everything will be via the portal.
Perfect. Thank you, Diana. And for those of you who are interested in upcoming events hosted by UCR Health, June events include New Moms Boot Camp, which is June 9th at 12 p.m. Also, What's Up Doc, specifically multiple sclerosis disease mini-series part 3. And Dr. Glassy offers stress management group medical visits in June. It's going to be June 30th from 10 a.m. to 11:30 a.m. And that concludes our presentation for today. If you do have any questions, feel free to visit ucrhealth.org and we can assist you there via web chat. If you have any questions for Dr. V, please also send us an email or contact us, or even web chat, and I'll be sure to connect you with Dr. V. And we welcome patients to UCR Health. Thank you, Dr. V. I appreciate you joining us today.
Thank you, Stacy. We all love being here.